Good afternoon, and thanks for stopping by Across the Fence. I'm Keith Silva. March is set aside as Deep Vein Thrombosis Awareness Month. Who knew? Despite my attempt at cheap laughs, DVT, as it's better known, is no joke. According to the CDC, 100,000 people die each year from this condition. DVT is caused when blood clots form in deep veins, like those in the arms and legs, and it can develop without warning, especially when traveling or seated for long stretches at a time. When DVT occurs, it's considered a medical emergency. Today we'll talk about DVT, its symptoms, and prevention with our guest, Dr. Karlyn Martin. She's a hematologist at UVM Medical Center and an associate professor of medicine at UVM's Robert Larner College of Medicine. Thanks for coming in, Dr. Martin.
Thanks for having me.
Okay, DVT, how many people are affected by this each year?
We think the number is about 600 to 900,000, both DVT and its closely related blood clot, pulmonary embolism. There's no national or state surveillance program, so those numbers are estimates, but that seems to be about the number affected annually.
Pulmonary embolism, using your very fancy doctor words, is that a heart attack? Is that?
It's not. It's
Okay.
it's another blood clot in the vein system.
Okay.
So what happens is these DVTs in the legs or the arms can break off, travel or embolize to the vessels in the lungs where they get lodged and cause symptoms like chest pain and shortness of breath.
You've been at UVM about a year and a half now. What sort of numbers are we seeing in Vermont for DVT?
Again, we don't have exact numbers, but we can estimate based on how many blood clots affect Americans each year, and then use the population
Right.
of Vermont.
Mm-hmm.
So we think about 1 to 2 per every 1,000 person is affected by these blood clots, which would be somewhere about 650 to 1,000 people in Vermont
Wow.
every year affected by blood clots.
We were talking before the taping, and then also as I was getting the script together, and I have family who lives out of state. Sometimes we take long car trips, and so you made me a little paranoid and a little nervous. These blood clots can occur. One of the issues or places where it happens is long times of sitting. Mm-hmm. And I was kind of like, well, what's the clinical definition of a long time? So what are we sort of talking about is sort of something that can cause these DVTs to happen?
Sure. We know that long periods of what we call immobility can lead to these blood clots. So when we think about travel, the evidence is better for air travel, and we're talking long haul flights abroad, 10, 12, 15 hours on a flight. But I do think there is some association with sitting in a car for 8 to 10 hours
Right.
without getting up and walking around. And other situations that we know where sitting around can unfortunately increase your chances of blood clots are things like being in the hospital, really sick in bed, laying in bed, not being able to get up. All those conditions or situations certainly increase a person's chance of getting blood clots.
So is the way to ameliorate that to just get up and walk? No blood clots, you're all set?
I wish it were that simple, but certainly that can help. So we do ask people to try to get up and walk around, either when you're on the plane, walk the aisles. If you're at a desk job, try to get up and walk around. And as I tell my patients, you don't have to be out running marathons, but every couple of hours getting up, it's actually the muscle contractions in the calves that kind of push that blood back up and prevent it from sitting and pooling where it is prone to forming blood clots.
What are the symptoms? So we're going to get up and take a walk if we've been sitting in the car, or walk around a plane if we're on a long flight. But what are the symptoms of DVT?
There are 4 symptoms we talk about. Some people have none, and some people have all 4. Usually people have 1 or 2. Pain, swelling, redness, and warmth. So pain, unexplained pain in the legs, usually back of the calf, but can be anywhere in the legs. Swelling, one leg bigger than the other. And then redness and warmth, areas of the skin warm to touch or red in color. Those can all be symptoms of the DVT type of blood clots.
What's the risk?
the risk of having a blood clot. So certainly it can be uncomfortable. If it gets bad enough, the blood flow in the leg can be compromised. But we really worry about it breaking off and traveling to the lungs where it becomes pulmonary embolism. Those can be fatal at their most severe. And so that is what diagnosing the blood clot, having people recognize the symptoms, getting to the hospital and getting on treatment right away is meant to prevent the blood clot from growing, extending, and also traveling to lungs where it really causes some severe outcomes.
More at risk men, women?
Both. Men are a little bit more likely than women to get blood clots, but I think what's really important is they affect everybody. So we see young teenagers all the way to 99, 100-year-olds at our clinic. It really affects the entirety of the population. So everyone should be aware of them and get checked out if you have the symptoms.
What about African Americans versus white folks? Is there more susceptible to, veins are veins, so, but do you see more DVT in African American population?
The studies would show that the pulmonary embolism and DVT are slightly more common in African Americans than people of European descent. I think importantly, it hasn't been shown to be biologically related or related to genes at this point. So again, everyone is at risk.
So I bring up African Americans because Serena Williams, the tennis goddess, she had several DVTs during her playing days, and that's not uncommon. That's something that can happen, multiple ones, even for an athlete at the top of their game.
Yeah, I think that emphasizes how common these are and how they can affect everybody. As a tennis player myself, I revere Serena Williams, but I think the fact that she was diagnosed with these blood clots, at the height of her, career, when she was one of the best athletes in the world, shows that it really can affect anybody.
Serena Williams not sitting around a lot either.
Exactly. Although I believe and this is all from the publicly available media, I believe one of them was after a leg injury, so a common reason, and her second event was after pregnancy. So again, a time that we know the chances of having blood clots are higher.
Are there long-term complications from DVT?
We like our patients to think of DVTs as a chronic disease with chances of recurrences. So having another blood clot is a possibility. The other consequence that we know of long term is what we call the post-thrombotic syndrome. And essentially the blood clot heals, but the vein can have some damage to it where people can have long-term symptoms as a result of that. So things like aching, heaviness, discomfort, chronic swelling, and at the more severe end, people can develop ulcers or wounds on their legs. And so they certainly can have long-term complications.
Not to get totally off the subject, but you were saying how DVTs are also similar to stroke in the fact of how often they occur, or what's the connection between stroke and DVT?
So the incidence, meaning how many people are affected by them, are pretty similar between DVT and PE together and stroke. But I think the awareness, the existence of the DVT and PE type of blood clots is much, much lower than stroke. The symptoms people don't recognize as much as stroke. And I'm not sure why that is, but that's part of why we're here and why March is DVT Awareness Month, is trying to get people to better understand. The stroke is a blood clot in the artery system most commonly, whereas the DVT and PE type of blood clots are in the vein system, and so that's how we distinguish the two.
We talked a little bit about preventative measures as far as walking around, getting up during those long times of sitting. Are there any other preventative measures? This sounds like, blood clot's a blood clot. You can't really not clot if
Well, yeah, I think it's important to understand that our body clots naturally to stop bleeding, but these these clots are when the body has gone too far and it's making blood clots when it shouldn't. There are certain situations, risk factors as we call them, that certainly increase the chances of having a blood clot. So we know a lot of blood clots happen after people are hospitalized, after they undergo major surgery, if they have a leg injury or in a cast. And so talking to your doctors or your healthcare team about whether you should be on a preventative blood thinner in those situations, should you wear compression stockings, can you get up and walk around in the hospital to try to prevent these blood clots? Keeping your weight healthy, keeping active, not smoking are all important ways to minimize chances of blood clots as well.
All good ways to minimize, to maximize good health as well.
In general, agreed.
There was a recent headline in the National Institute of Health, a report that said long-term exposure to air pollution can be linked with blood clots. Talk about that.
Yeah, I think we understand that inflammation is closely associated with developing blood clots. And so my thinking is that chronic exposure to air pollution likely triggered the body's immune system, causing inflammation, and that may then increase the body's chances of developing blood clots. We know that the immune system and specifically inflammation is tightly linked to the body's blood clot system. And so there are other conditions with chronic inflammation, inflammatory bowel disease, a condition called lupus that are associated with lots of inflammation that also have a higher likelihood of having blood clots. So that would be my guess as to why it's associated.
A little less than a minute left. Exposure to wildfire smoke is what this study from NIH was talking about. So just one of those things, another precaution if you're, of any age, but, probably don't stand around and breathe in a lot of wildfire smoke.
That's right, yep.
Dr. Martin, thank you very much for coming by and raising awareness about DVT. I really appreciate that. For more information on deep vein thrombosis, visit uvmhealth.org and search DVT, which will bring you to the docs like Dr. Martin in hematology. That's our show for today. I want to thank the hardworking crew behind the scenes here at WCX. I'm Keith Silva. This is Across the Fence. Thank you for stopping by.